Now, while we are talking about these individuals who have the personality traits that are quite abnormal or that are ranging the abnormal behavior, and that is basically affecting their normal lifestyle, they're unable to cope up with the work and the stresses of life, they're unable to develop those interrelationships or those peer relationships in their life, we're going to help these people out by first of all assessing them or diagnosing them or to be belonging to the particular clusters of the personality disorders that we've already talked about. So we are done with the first cluster, that is the odd and the eccentric cluster, which is named as the cluster A individuals. And then we move on to the cluster B group. So the people who are belonging to this cluster B group have that particular kind of characteristics. They can be the borderline personalities, they can be the narcissistic individuals as well. So having those borderline personalities can be basically the people who are suffering from the antisocial behaviors. Then we have these narcissistic individuals who have the delusions of grandiosity, and they're also put in this cluster B group. So basically, when we have a generalized look at the people who are belonging to the different clusters of the personality disorders, they have those particular firm beliefs, and that firm belief is quite predominant in that particular cluster that we're talking about. In the first cluster, we just had a look at that antisocial behavior, and that was quite predominant over there. So now we're going to discuss the second cluster over here. So when we talk about this cluster B, it can be the people who have that impulsive behavior. So they're quite impulsive in their decisions and even in their actions. That consistency is not found in these people who are belonging to this cluster B group. Then we have the borderline personality disorder, and some people are suffering from even this kind of a personality. And then we have the histrionic personalities. The narcissistic individuals can also be put into this cluster B group, along with this histrionic, borderline, or the impulsive disorders as well. So the people who are belonging to the cluster B group, they have a pattern of behavior that is viewed as dramatic or emotional. So they're more expressive in their behavior rather than being succulent, eccentric, and antisocial. They are more expressive in their behavior. They are more dramatic. They are more emotional in their behavior. They often display erratic or impulsive behavior, generally a marked absorption that results in a diminished capacity for empathy is also a part and parcel of their personality. Now, when we talk about their antisociality, that diagnosis is not given to the under age of 18 people. Usually they engage in the illegal activities, routinely practice the deceit. Often they are aggressive and violent in their behaviors, and they're typically irresponsible. So this is the word that is usually given out by the people who are surrounding them, or when we take a collateral history, all of these behaviors, that is the illegal activities, the substance misuse, or even the deceit phenomena, being aggressive and violent, all of these behaviors are usually found out when you take a detailed past history, or the past history is taken from the collateral people or the primary caregivers as well. They generally ignore the rights and feelings of others, and they rarely show remorse as well. So people who are usually emotionally unstable, they're usually impulsive in their behavior. They are suffering from the borderline personalities. Now, when we have a look at the people who are suffering from this borderline personality disorder, usually this disorder is traced out into their childhood. That is, when you take the detailed childhood abuse history or the sexual assault history, they're going to give you clues towards that particular childhood abuse, and now they have developed that particular borderline personality disorder. And sometimes this borderline people who are suffering from this borderline personality disorder, they're involved in other traumas or assault as well, or they develop a post-traumatic stress disorder. So this is the view of consequences that they go through. They can go through an incident of assault again. They can basically cause traumas to the people who are surrounding them, or they can go into a phenomena which is known as the post-traumatic stress disorder, and can be one of the phenomena. Typically demonstrate the erratic interpersonal relationships. They are fluctuating self-image, or the effect, that is the mood disorders, are also quite predominant in these people with borderline personality disorders. They have a marked impulsivity in their behavior. They frequently engage in the suicidal or the self-mutilating behaviors. They're noted for extremes in affect and in judgmental behaviors as well. So when we talk about these people who have these borderline personality disorders, we've already evaluated that it is their childhood that is basically leading them into into developing these borderline personality disorders with the passage of time in their adolescence or in their adulthood. They rarely see themselves or others in a balanced way. These clients are the most likely of people with personality disorders to seek treatment. So they should be sought out for the treatment. Then we have another group of people belonging to this cluster B group, that is the histrionic people having the hysteria or the aggressive behavior is quite frequently observed in these individuals. They are characterized by emotionality and attention-seeking behavior. They are fine until they are the center of attention, will use physical appearance, speech and emotions to command others' attention. Then we have the narcissistic behavior. A grandiose sense of self-importance is again very important, a need for importance. And then we have a reduced capacity of empathy that is also quite predominant in these individuals, having these delusions of grandiosity. They want to be the center of attention at all the times, and they want to feel that importance. So that is again very important for the people who are belonging to this narcissistic group of individuals. They often seem to have an exaggerated sense of entitlement along with them. They expect to be admired and obeyed by others as well. So this is basically the group of people that we are discussing. When we are discussing the traits of the different groups of people that are belonging to this cluster B group, one thing is quite predominant over here, that a lot of features are overwhelming in all of these groups. For example, being the center of attention, people who are basically borderline or who are emotionally unstable, impulsive, or narcissistic. They're belonging to this cluster B group, and they have these basically having those delusions of grandiosity, as well as they want to be the center of attention. So this is the emotional liability of people who are belonging to this cluster B group that we're talking about right here. They usually seek treatment when they are frustrated by others. So they do not seek treatment normally. They do not come up to the psychiatrist normally. But when they need treatment, it is because when they are frustrated by the people who are surrounding them. So in this section, basically, we summarized the second group or the second chunk of people, that is the cluster B group. What are the primary characteristics of the people who are belonging to this group is again very important for the diagnosis or the correct diagnosis of these individuals. So that is the end of this section. Thank you for watching sqadia.com.